We have a lot of factors affecting our prognosis of separated file cases and also affecting our decision in choosing the right treatment plan. Factors related to tooth, related to the broken file, related to the operator, and of course, related to the patient. First of all, the factors related to the tooth. Type of tooth, indeed, surgery or episectomy or bypass or even retrieval in an anterior tooth is much more easier than premolar, is much more easier than molar. Cross-sectional shape and diameter of the root canal, indeed working on a lower first molar, for example, and if you are working on the distal big root, it will be much more easier to do whatever the treatment option you take more than the mesial roots or the mesial canals. Position of the fragment in relation to the canal curvature. And here we have to stop a little bit because according to this factor, we will have two treatment options if we are going to bypass or retrieve. That's why in most of my cases, if you have a broken file before the curve, above the curve, I will go for sure, if I have a microscope, for retrieval. But if I have a broken file beyond the curve, indeed, I will go for bypassing. And we will talk about this in details in the next slides. File canal wall interface, of course, if I have this gap, it will be much more easier to bypass or even to retrieve. And before we are going or leaving these factors related to the tooth, we have to mention that all the studies stated that the pre-operative condition of the file, of the tooth, if we have a tooth, a vital tooth, without periapical pathosis, it will have a better prognosis indeed. Now, factors related to the broken file. Type of the broken file. It's manual file, hand file, or rotary file. Indeed, bypassing, retrieving, or whatever will be much more easier with stainless steel file. Design and cross-section of the file. K file, for example, can be retrieved easier than H file, headstrong file. Length of the broken file. Sometimes if we have a broken file more than 3-4 millimeter, it can change completely the technique that we are going to bypass or even to retrieve. Generally, it's believed that dealing with nickel titanium will be much more difficult than stainless steel. Stainless steel files, simply the response of stainless steel files to the ultrasonic energy, especially during retrieval, will be much more better because the stainless steel file absorb the ultrasonic energy and immediately jump out of the canal. But the nickel titanium is completely different. It's a brittle material, low yield strength, and it can break in a secondary fracture way. And of course, the nickel titanium, when it breaks, it against the outer wall of the canal, leaving the most pleasant inner wall to deal with. Also, we have factors related to the operator, patience, to have a good protocol, knowledge, to be trained to deal with such cases, to be familiar with the techniques and instruments, to have perseverance, and indeed creativity, but to a certain limit, please. And I always say that creativity is good, but sometimes it kills. So please be creative, but to a limit. This elephant standing on the bowl, we always say that balance is the key to life. You should be this elephant standing on a bowl and you should have this balance. Why? Balance between you have to deal with the problem, the file, and also you have to be conservative. That's why you have to have this balance. And from this balance, bypass as a treatment option, as a more conservative treatment option in some certain cases, it came out. Also, we have factors related to the patient, the extent of mouth opening, limitation in access to the tooth, the time and anxiety level, and you have to explain everything to your patient. And also, one important thing is the patient expectations, because sometimes you have a broken file case and it's much more better and conservative to bypass, but the patient insists that he wants the file to be removed. And when you explain everything to the patient that removing a file in such position may weaken the root and may cause fracture or vertical root fracture or whatever, but he insists to remove the file. So you have to deal exactly and explain and discuss every treatment option with your